everyone, my name is Ashley. Thank you for tuning in. So today we're going to talk about how to become a women's health nurse practitioner. I get this question a lot. I have people asking me, hey Ashley, can you do a video about how to become a women's health nurse practitioner, or talk about your journey to becoming a women's health nurse practitioner, or how do I become a women's health nurse practitioner? What are the steps? So this video is going to be dedicated to that. So if this is your first time tuning in, my name is Ashley. I'm a women's health nurse practitioner. I currently practice in maternal fetal medicine, which is high risk obstetrics, meaning that I take care of high risk pregnant women. So you have three categories of patients. You have patients who have pre-existing conditions and they become pregnant. So whether that's diabetes, high blood pressure, seizures, heart failure, kidney disease, the list can go on. Anything you can think of, we see it. Second category of patients would be women who become pregnant and they develop certain conditions, whether it's high blood pressure during pregnancy, diabetes during pregnancy, conditions like cholestasis of pregnancy. And the third category of patients are women who are healthy and pregnant, but there's something wrong with the baby, whether that's a cardiac defect or something is going on with baby's spine. So those are the three types of patient categories that I see. So in starting your women's health nurse practitioner journey, the first thing you want to do, you want to examine your why. Why do you want to be a women's health nurse practitioner? And I will tell you, money can't be your only driving factor. So my why is I wanted to decrease the maternal mortality rates among African American women. So as you guys know, black women are more likely to die during the childbirth and postpartum period than any other race of people. So that has always been my why, my driving factor. In my career now, I'm helping in ways to decrease that. I believe I am. Well, I know I am. So that is my why. That was my why when I was applying to MP programs and I had to write an essay. That was always my why. Second thing is you need to figure out your learning style. So there are many different quizzes. You can Google learning style quizzes and you can take a quiz and figure out your learning style. Knowing your learning style will help you in your nursing school journey and also in your nurse practitioner school journey. I've always thought that I was a visual learner, but when I took a learning style quiz, I found out that I am more of an auditory learner. The way that I learn, I go to my lectures, listen to my professor. I have to be in the front row. I print off my PowerPoints. I'm not the type to take notes on the computer. I absolutely hate taking notes on the computer. I'm more of a pencil, paper, colorful pens type of girl. The girls who get it, and the girls who don't. So I'm one of those type of people. So after lecture, I would go home. I would create colorful flashcards based off of the PowerPoint slides. And I would study the index cards and commit those to memory. And in order to critically think and apply my knowledge, I always did practice questions. That's the method I used in nursing school, and that's the method I used in nurse practitioner school. So those methods work for me. So you'll have to know what works for you in order for you to be successful in your nursing program and also your nurse practitioner program. When picking a nursing school, make sure that it's an accredited nursing program. It has to be an accredited nursing program. I went to the University of Tennessee at Knoxville and got my bachelor's of science in nursing. Once you graduate with your BSN, you have to take your NCLEX, have to pass your NCLEX. Your NCLEX is what licenses you to practice as a nurse. With your NCLEX, I use the HRSA review to study. I have a video about that. I'll link it above. So once you pass your NCLEX, I recommend getting at least 2 years of experience in a women's health setting. So whether that's bedside nursing, you working in labor and delivery, postpartum, antepartum, or whether that's working in like an OBGYN clinic, even a maternal fetal medicine office, in some type of women's health setting, I would recommend getting 2 years of nursing experience. because that has helped me tremendously in nurse practitioner school, and also it helps in my role as a nurse practitioner. You need that good foundation. I've even seen some nurse practitioner students, while they're in their NP programs, they're starting off at bedside roles, whether that's labor and delivery, postpartum, or antepartum, so that once they graduate from their nurse practitioner programs, they'll already have that 2 years of experience at the bedside. You can go that route. I did the route where I worked as a postpartum nurse for about 2 to 3 years, and then I went back to school. Apply for women's health nurse practitioner programs, and I'll provide a link down below of a list of the different women's health nurse practitioner programs. I specifically went for women's health nurse practitioner. I didn't go for FNP because I knew that women's health was always something that I wanted to do, so I didn't want to waste my time in the FNP program. You can specialize as an FNP and work in a women's health setting as well, but I went the women's health nurse practitioner route. I went to Vanderbilt University for their women's health nurse practitioner program. That was a 2-year program, part-time. I worked PRN and postpartum nurse. Once you graduate, you have to sit for your boards. Basically, it's your women's health nurse practitioner certification exam. So you have to pass your boards in order to apply for your APRN license, your advanced practice registered nurse license. So I used Fitzgerald and the Kelsey book to pass my women's health nurse practitioner boards. So after you pass your boards, then you're able to apply for your APRN license. Here in Tennessee, it took about a month for me to get my license. Started looking for jobs. I actually started looking for jobs once I graduated. I know a lot of my classmates, they secured jobs before graduation. So as a women's health nurse practitioner, you are not just limited to working in obstetrics and gynecology. I will provide a picture right here of the different type of settings that you can work in as a women's health nurse practitioner. You can also practice in primary care settings where you're seeing women. You can practice in breast clinics, you know, for women who have breast cancer. Women's health nurse practitioners, we have endless opportunities, endless amount of settings to work in. Now, I will say it took me a year to get my women's health nurse practitioner job because I wasn't willing to relocate. I'm sure if I was willing to relocate, I would have been able to find a job sooner. I know a lot of people, you know, they say the NP market is saturated, the NP market is saturated. But if God has called you to do something, then He's gonna make a way for you to be able to do that. And His timing is always the right time. Since I've shared my journey, if you guys want to know more about my journey or more about the specifics of my journey, or you need somebody to help just coach you through the journey and, you know, create like a guide for you and just a mentor or somebody to talk to about your women's health nurse practitioner journey, whether it's how to be successful in your nursing program, your women's health NP program, your job search, your boards. I'm offering coaching one-on-one sessions now. The booking link is in the description box, and I look forward to speaking with you all and getting more women's health nurse practitioners in the field, because we need more women's health nurse practitioners. We need more Black women's health nurse practitioners, especially to help decrease maternal mortality rates among our community. And you know, I have such a great feeling being able to take care of patients that look like me, and I love how my patients respond when they see a Black nurse practitioner taking care of them. We need more people. We need more Black women's health nurse practitioners, more Black midwives, more Black nurse practitioners in general.